Hey team, welcome to the MMOA podcast. I'm Macy Bolt, outpatient physical therapist and TA with the older adult division of ICE Physio. Today we are talking about a cool new study that is really going to help simplify your decision making on when to perform a more in-depth cognitive screen for your older adult patients. So we are going to unpack a recent article that gives us some really cool clinical utility of the 4-square step test to screen for cognition. It was published in the Journal of Geriatrics in July and looked at the association between results of balance tests and results from the mini mental state exam in the ability to predict cognitive impairment. So, this study has some really cool clinical screening implications. And I found this cool. The researchers also used AI to predict patterns and look at associations beyond what traditional statistical analysis can do. So, this study was also looking at that. We're not going to talk about that as much today, but I did find it really interesting as we start to see more and more use of AI in research and in clinical practice. So, back to the study. One of the outcome measures that they used was the 4-square step test. So we're going to start there and cover what that is so that we're all on the same page. So the 4-square step test requires 4 canes and a stopwatch for setup. So it's really simple to run. And the key with this is it needs to be a cane, not a line of tape on the floor. We want our patients to have to clear that step, clear that cane in order to take that step, not be able to slide their foot into the next square. So what you're going to do is you're going to set up the 4 canes in a cross pattern on the floor. And so that it basically makes, like if you remember playing Foursquare as a kid, it makes that sort of a pattern. So the 4 canes are set up in a cross, like I mentioned, and your patient is going to start in the bottom left corner facing a wall in front of them. Then what they're going to do is they are going to take both feet and step into each of the 4 squares in a clockwise pattern and then counterclockwise. So they're going forward, sideways, sideways, and then sideways, forward, sideways, backward, and ending up in that same square that they started with. The goal is for the patient to do this as quickly as possible and to stay facing forward the entire test. So this test has a really well-documented cutoff score for falls risk. So if your patient scores greater than 15 seconds on this test, that indicates that they are at increased falls risk. When you're running this with your patients, you're doing 2 trials and you're taking the better score of those 2 trials. So now that we've established what the 4-square step test is, let's go back to the study that we're talking about. So the researchers for this study took 128 older adults between the ages of 65 and 85, all residing in nursing homes. All of the participants were able to ambulate without an assistive device and were without any other neurological, orthopedic, cardiovascular, or psychiatric diseases that would prevent them from walking or doing independent mobility. These people were moving around independently without any sort of assistance. The researchers in this study took these patients through a battery of cognitive tests and balance tests, including the mini mental state exam was the primary one that there were findings on from the results, but they did the mini mental state, the Hopkinson abbreviated mental test, the 4-square step test, the tug, single leg stance with eyes open and eyes closed, and functional reach. We are not going to get into the cognitive screening exams today, but if you're looking for more information on that and how to implement that into your practice, join us in a level 1 course online. And we spend a whole week diving deeper into cognitive screening and how to use that. So definitely join us there if you have more interest in that. So in the study, what the results found was that older adults with normal cognitive status completed the 4-square step test in a significantly shorter amount of time than those who had a mild or a severe cognitive impairment. And that was based on the mini mental state, was where the significant finding was. So let me repeat that again. Older adults with normal cognitive status completed the Foursquare step test in a significantly shorter amount of time than those with a cognitive impairment. So they were able to also determine a Foursquare step test cutoff time to differentiate between those with normal cognition and those with a cognitive impairment. That score was 14.56 seconds, and those results were found to be really highly sensitive. So what that means is that if a patient takes longer than 14.56 seconds on the Foursquare step test, that correlates with an increase in cognitive impairment for your patients. This is big, people. This really allows us to take a test that many of us are already doing and a very simple test to run and gives us so much insight into a patient's cognition. So let's now go into what this actually means in clinical practice, because I really think it's important that we don't take any of these results out of context. So does this mean that every patient who I run the Foursquare step test on who scores greater than a 14.5 has dementia and that we should tell them that they have dementia? Absolutely not. I can't emphasize that enough. What this does mean is that if we are running the Foursquare step test and we have a patient in front of us who takes longer than 14.5 seconds to complete the test, that should cue our rehab brains that further cognitive assessment is warranted. And we should be doing further cognitive assessment with those folks to get a really good picture of what's happening with this patient. Additionally, if that score is above a 15, based on that really well-established cutoff score we talked about earlier, we know that that patient is at an increased risk of falls, and that is absolutely within our wheelhouse to get to work on. So basically, the results of the Foursquare step test can be used as a screener that will help us get a clearer picture of the cognitive status of our patients, because we'll be capturing kind of who would benefit from that further assessment. We are, as rehab providers, able to do cognitive screening with our patients, and we should be, because I think so many things get missed if we're only doing an A&O times 3. If we go deeper and we really start to assess these things, we are going to find things that patients are really good at compensating away from and masking. So the way that I see it, this is a really, really easy and quick and low equipment need test that we can be doing with our patient that is going to give us such a beautiful snapshot of, number one, falls risk. Number two, the ability to sequence a task. By having them go through that sequence of stepping into each of the 4 quadrants and then back, they have to do a lot of processing to change directions, to make sure they're clearing the cane. All of that requires that cognitive load, which is why these measures are so well connected. So falls risk sequencing and gives us a really nice cognitive screener to help us determine the best next step for the patient and if we need to be triaging them out for further care if they have not, received that yet. And the whole test takes less than a couple of minutes to run. So let's recap what we talked about. We started with what the Foursquare step test is, where the patient is stepping clockwise and then counterclockwise into 4 quadrants of a square as quickly as possible. Based on the score that your patient gets on that test, if that score is above a 14.5, it would be absolutely appropriate to do a further cognitive screening, like the mini mental state exam, to get further information about your patient's cognitive status. As a patient-centered rehab professional, when you're doing your balance and mobility assessments, add the Foursquare step test to your toolbox. It is such an excellent measure to look at falls risk, balance and mobility status, sequencing ability, and cognition screening. This is really going to help our folks to be able to receive care in a timely manner and make sure that we are not missing and letting people fall through the cracks who maybe need more intervention as far as cognitive status goes. Thank you so much for joining me today. If you are interested in learning more about outcome measures and really dialing in your care of your older adult patients, click the link below in the caption to receive our biweekly MMOA Digest emails. It is an awesome resource, really, really palatable. It takes less than 5 minutes to read, and it gives such good clinically relevant information. And then we also would love if you joined us in an upcoming course. We will be live in Miami, Florida, December 20th and 21st, and Fort Myers, Florida, and Greenville, South Carolina, January 10th and 11th. Our L1 cohort online starts the week of January 14th, and our L2 cohort online starts the week of February 2nd. We can't wait to connect with you soon.